On behalf of the Department of Behavioral Health and Developmental Services, I would like to welcome you to the Virginia Individual Developmental Disability Eligibility Survey Training, better known as the VIDES. I am Ann Camperini, and I'm the Regional Support Specialist for Region 3, and the purpose of this training is to provide a basic overview of the components within the VIDES. The VIDES has 3 versions with specifically designed questions to assess developmental tasks based on age. The infant VIDES will be completed for those individuals under the age of 3. The VIDES for children will be completed for those individuals between the ages of 3 and up to their 18th birthday. And the adult VIDES will be completed on all those individuals who are 18 and older. 12 VAC 30-122-50 specifically addresses the criteria to be met for individuals seeking DD waiver services. The DD waiver encompasses 3 waivers for persons with developmental disabilities: the community living waiver, the family and individual support waiver, and the building independence waiver. Per regulatory guidance, an individual must be diagnosed with a developmental disability and meet ICF-IID level of care as defined in the VIDES at least annually. This includes diagnostic eligibility. Individuals must have an evaluation completed by the appropriate licensed professional that indicates a diagnosis of developmental disability, and functional eligibility. The VIDES determines the functional eligibility for DD waiver services. To meet the functional eligibility for DD waiver services, an infant under 3 must meet 2 out of the 5 categories on the infant VIDES. Children ages 3 to 17 must meet 2 out of the 8 on the children's VIDES. And adults 18 and older must meet 3 out of the 8 categories on the adult VIDES. The VIDES is completed by the support coordinator who has been trained in the administration of the tool. The VIDES must be completed in the presence of the individual, though others who know them well may be respondents. Respondents are people who can provide information about the person and to help the individual communicate. Individuals choosing not to participate in the VIDES assessment may jeopardize their waiver services. For DD waiver recipients, the VIDES must be completed within 12 months of the previous VIDES and anytime there's a significant change in the individual's life that potentially affects the results of the survey. For individuals on the DD waiver waitlist, the VIDES is completed once to determine eligibility and again no more than 6 months prior to active DD waiver enrollment. The Waiver Management System, or WAMS, will capture the date and appropriate questions for each individual being evaluated. When completing the VIDES, assess the individual as if no services or needed supports were in place. If an individual does not use words to communicate, make sure there is someone present who knows him or her well. The individual may use his or her communication device during the administration of the survey, but when scored on communication, the use of the device cannot be considered. There are age-related questions on the infants and children's VIDES, and WAMS will pre-populate those questions based on age. There is also a notes section that is used to clarify or explain a score. There are 2 types of scoring that are used throughout the VIDES. They are type of assistance and frequency, and each has a numerical value. WAMS will prompt the assessor with the type of scoring that needs to be used in each section. Please be familiar with the scoring on type of assistance needed. No assistance means no help is needed. Prompting and structuring means prior to the completion of the action described in the item, some verbal direction and/or some rearrangement of the environment is needed. Supervision means that a helper must be present during the completion of the action described in the item. and provide only verbal, gestural prompts and/or guidance. Some direct assistance means that there must be a helper present during the completion of the action described in the item and provide some physical guidance and support. Total assistance means that a helper must perform all or nearly all actions described in the item. Similarly, the definitions of frequency are clearly defined and questions should be rated appropriately. Rarely means that the behavior occurs quarterly or less. Sometimes means that a behavior occurs once a month or less. Often means that a behavior occurs 2 to 3 times a month, and regularly means that a behavior occurs weekly or more. We will now review the infant VIDES and all possible questions that are prompted. However, keep in mind that when completing the survey in WAMS, only pertinent questions will populate, as some questions are based on age. All individuals under 3 will be asked these questions regarding health status. This section will record the frequency of assistance with tasks such as nursing care, seizure management, and occupational or physical therapy. This section assesses age-appropriate communication and responses such as babbling, saying short sentences, and using gestures. Questions will vary based on ages 6 months, 1 year, 18 months, and 2 years. This section reviews the individual's motor skills, such as rolling over, getting dressed, walking, and manipulation of tangible objects. Questions will vary based on ages 6 months, 1 year, 18 months, and 2 years. This final section of the infant's VIDES assesses social and emotional development, such as sharing, recognizing familiar faces, and demonstrating fear and happiness. Questions will vary based on ages 6 months, 1 year, 18 months, and 2 years. Next up, we will review the different components of the children's version of the VIDES. Similar to the infant VIDES, the VIDES for children will only populate questions that pertain to the child's age. The category of community living skills will only populate for children that are 6 and over at the time of the assessment. Similarly, the category of self-direction will only populate for children ages 10 and over. Dependent upon the age of the child being assessed under health status, questions can include frequency of medication administration, use of adaptive equipment, and diet or nutritional oversight. This section evaluates communication level and skill based on age group. Questions will vary based on specific age categories such as 3 years, ages 3 and 4, and ages 5 and older. This section evaluates a child's learning skills to include telling time, writing, simple math, colors, and orientation to person, place, and time. Questions will vary based on ages 3 and older, age 6 and older, ages 6 through 9, and age 10 and older. This section focuses on what, if any, type of assistance is needed with personal and self-care, such as grooming, showering, and eating. Questions will vary based on ages 3 through 5, aged 6 and older, and all ages. This section captures the type of assistance that is needed with ambulation, positioning, and transferring. Questions will vary based on ages 3 through 5, aged 6 and older, and all ages. This section measures the frequency of any behaviors that are aggressive, destructive, self-injurious, socially inappropriate, and/or sexual in nature. Questions will vary based on ages 3 and older and 6 and older. Community living skills focuses on what type of assistance an individual requires with instrumental activities of daily living and other tasks, such as food preparation, chores, making purchases, and others. Questions will vary based on ages 6 and older, ages 6 through 7, and ages 8 and older. The final section of the VIDES for children measures if an individual is able to effectively manage time and schedules, manage emotions, and be a self-advocate, among other skills. The response selections for this section are yes or no. Be sure to provide additional information in the notes section for any no responses. Questions will vary based on ages 10 and older and 12 and older. Next up, we'll review the different components of the VIDES for adults. The adult version differs from the VIDES for children in some of the categories only in the wording of the questions. All questions will be asked of individuals on the adult VIDES regardless of age. Questions in this section can include frequency of medication administration, use of adaptive equipment, and diet or nutritional oversight. This section evaluates communication level and skill to include things like how information is shared. Does the individual use words or phrases? And can the individual identify themselves, others, and their residents? This section evaluates the person's learning skills to include telling time, writing, simple math, colors, and orientation to person, place, and time. This section highlights what, if any, type of assistance is needed with personal and self-care, such as grooming, showering, and eating. This section captures the type of assistance that is needed with ambulation, positioning, and transferring. This section measures the frequency of any behaviors that are aggressive, destructive, self-injurious, socially inappropriate, and/or sexual in nature. Community living skills focuses on what type of assistance an individual requires with instrumental activities of daily living and other tasks such as food preparation, chores, making purchases, and others. This final section measures if the individual is able to effectively manage time and schedules, manage emotions, and be a self-advocate, among other skills. Similar to the children's assessment, the response selections in this section are yes or no. Be sure to provide additional information in the notes for any no responses. The suggestions on the screen are just a few examples on how the assessor can obtain additional information. While not mandatory, it may be helpful to have printouts, handouts, or visual cues that can help the assessor identify an individual's capabilities and provide evidence of task learning skills. VIDES prompts can be very helpful in an assessment, but should be appropriate for the individual being assessed. For example, a person with a visual impairment should not be asked to identify safety signs by sight, but rather should be asked how they identify safety concerns when they're in the community. When completing the assessment, respondents and individuals may struggle with answers or just give a yes or no without explanation. But the role of the support coordinator is to further prompt the conversation with obtaining a clear understanding of the support needs. If you have any questions about the VIDES or any specific questions about this training, please contact your assigned regional support specialist. You can see that they are all listed on the screen right now with region, phone number, and email address. Also on this slide is the contact information for the regional support manager and the SIS quality manager. Thank you for attending this training, and I hope you have a wonderful rest of your day.